In this lecture, I will be talking on food allergies and allergies to food mediated by allergen or food that has the capacity to cross-link the IgE antibodies bound to Fc epsilon R1. These are high affinity receptors on the surface of the muscle present in upper and lower gastrointestinal uh, tract, and this cross-linking by the allergens or the food will lead to smooth muscle contraction, and this result in vomiting and diarrhea. Increased mucous membrane of the gastrointestinal tract, uh, actually increased mucous membrane permeability allows allergen, certain food, to enter the circulation, which lead to asthmatic attack or atopic urticaria. When allergen through the blood taken to sensitized muscle in the skin, and this lead to wheals and flare. It is actually known as Brusnitz-Kusner reaction. So diagnosis for food allergies can be diagnosed through skin test, blood test, or oral food challenges. These known as actually oral or to induce immune tolerance through the oral food, actually by giving increasing amount of the food. So skin prick test, actually it is just by placing a drop of allergen on forearm or back and prick it in 15 to 20 minutes. Wheals and flares will occur if the test is positive. Blood test is to measure levels of specific IgE by radioallergosorbent test or assay known as RUST. So the treatment is through hyposensitization, in which the allergens are given gradually in increasing doses. So these allergens to which the patient is allergic are given in an increased doses. So repeated subcutaneous injections of allergens lead to shift or to a shift towards IgG production, or to a shift from T helper 2 to T helper 1 with turning off IgE response. IgG antibodies bind here to the allergen, so compete with for the IgE antibodies bound to Fc epsilon R1. These are high affinity receptors on the surface of muscle in upper and lower gastrointestinal tracts. So these IgG antibodies will bind to the allergen and prevent its binding to specific IgE antibodies bound to Fc epsilon R1 on the surface of the muscle. And so this will lead to formation of immune complexes that are removed by phagocytosis. So also monoclonal anti-IgE antibodies can be given, but however this deal only with free IgE and not with IgE that already bound to Fc epsilon R1 receptors. Subcutaneous immunotherapy is well established, but however, the risk of anaphylaxis has led to development of other administration routes, such as oral, sublingual, or nasal routes to avoid systemic anaphylaxis. Thank you very much, Professor Ahmed Bor.